Okay, guys, we're going to go ahead and get started. So, today we're just going to be talking about drug abuse awareness. So, we're going to start from the basics of what is it, and then we're going to just talk about drug abuse and drug addiction and what that looks like and what are the consequences of that decision. And then we're going to talk about what can we do to help. So, just to kind of summarize what we're going to be talking about today, and we'll just go ahead and get started. So, drug abuse awareness. Drug addiction. Addiction does not discriminate. It affects all types of people from all different backgrounds. Being aware of this issue allows people from all walks of life to open up. Many people fall into the delusion that addiction only happens to people who live in a certain part of the country or have specific backgrounds. However, the truth of the matter is that addiction is a disease. Addiction doesn't discriminate on whether you're race or ethnicity or on your gender. It doesn't discriminate on your socioeconomical status, whether you're rich or you're poor. It does not discriminate. Addiction can happen anywhere along those ways. Addiction is a disease, and this disease hurts people from all walks of life. Some are just better at hiding it. Some people are better at just being able to conceal what the drugs have, the effect that drugs have on them. We want anyone struggling with addiction to feel comfortable about opening up, and then opening up about the issue is that first step in choosing a better sober life. So that's the very first step. We need to get people to feel confident to open up, to be right there with us, to say, you know what, I am here if you need me. I'm here to be a listening ear. So what are these physical impacts of drug addiction? So understanding the links between mental health and addiction is important. However, it's also essential to understand the physical impact that addiction has on the body. In fact, the physical problems that drug cause are typically the result of mental damage that drug abuse causes. Some common problems, physical problems that people face include changes in body temperature, irregular heartbeat, changes in sleep pattern, brain damage, and even seizures. Most of these problems occur because the effects that drugs have on the brain. Drugs limit the ability for the brain to function properly, and the long-term result is brain damage when people don't get the help that they need. So a lot of times people think, oh, well, if you just stop using drugs, then you'll go back to normal. And unfortunately, that's not always the case because it causes brain damage. So if you use specific drugs, and we're talking hard drugs like meth, cocaine, heroin, those kind of things, if we're using those drugs, and even opioids too, if we're using any of those kind of drugs, it's important to remember that they can have long-term effects on their brain. They limit its ability to what it can properly function, and we want to make sure that we're not limiting what the brain can do. The link between addiction and mental health. So drug addiction awareness allows us to educate ourselves on all parts of the issue. Drugs alter the chemical balance in the brain. These changes usually involve increasing the production of dopamine. Two of the top jobs of dopamine include triggering the reward center in the brain and blocking pain. Unfortunately, anytime people alter the chemical balance of their brains, they are at risk of developing mental health disorders. So most of the time, a mental health disorder is a chemical imbalance. It's the result of a chemical imbalance. So if you have severe depression, that's a result of a chemical imbalance. If you put a drug in your body creating this chemical imbalance, then you risk allowing yourself to develop mental health disorders. The brain consists of parts that work together as a team. Each of these parts has its own responsibility for handling specific functions and performances. Drugs make it difficult for these areas of this brain to communicate properly with each other. The parts of the brain that work together include the brain stem, the cerebral cortex, and the limbic system. The brainstem controls functions such as breathing, sleeping, and regulating heart rate. The cerebral cortex controls information regarding the processing of senses such as taste and touch. However, the cerebral cortex also gives the brain the power to think and make decisions. So we're messing with some pretty important parts here. We're messing with the parts of breathing, sleeping, and regulating heart rate, and processing your taste and your touch and senses of those nature. And then also the ability to make decisions, to think and make decisions. Drug addiction awareness and mental health are two matters that go hand in hand. Addiction often has underlying roots. It can stem from depression, anxiety, bipolar disorder, and a very variety of other reasons. So sometimes people get addicted to drugs because they're self-medicating. They're medicating another issue. That could be because of pain. That could be with they don't know how to deal with a certain situation, whether that be grief, the loss of a job, the loss of a family member. That could be a variety of different things, but addiction could be stemming from an underlying cause. So there could be an underlying disorder that began this whole process. And then the same is true is now after a person uses a whole lot of drugs, there could be a long-lasting mental health disorder because of the damage that the drugs have done. So there's a chance both ways that a person could have a mental disorder and be a drug addict. Why is mental health so important? Simply knowing the link between mental health and drugs is only half the battle. It's important to know that mental health and drug addiction awareness are essential to fight against drug addiction. The importance of spreading drug addiction awareness is why so many rehab centers offer dual diagnosis treatment for co-occurring disorders. This treatment allows rehabs to address both mental health disorders and drug abuse. Mental health awareness is important because it also lets people know that they are more at risk of developing an addiction than others. The World Health Organization says that around 20% of children in the world have a mental health disorder. Scientists believe that these children that have these mental health disorders are more at risk developing drug addiction than any other individual that does not have mental health disorders. So this is really important in the realm of they could be trying to self-medicate, they could be trying to fix something else. And so we need to make sure that whenever children are going through, whether that be a mental health disorder, whether that be just mental health issues at the time, making sure that they get the help that they need to know that drugs are not the option. They are not the way to go because they have so many long-term consequences. So realistically, what can we do? We've talked a lot about what happens and the consequences of that and all those things, but what can we do right here, right now? How can we raise awareness? We can volunteer our time with local organizations. It's a great way to raise awareness about substance abuse. Drug addiction not only benefits those who may be going through it, but it can also help prevent those from even starting. So if you know the effects of drug abuse and you know what it has the potential to do to your body, then there's a chance that you may not even start attempting to medicate with drugs. Millions of lives have been touched through events that have raised addiction awareness. Coming together as the community holds a lot of power, and it encourages a we're in this together kind of mentality. So you're not alone in your fight with addiction. You're not alone in your fight with anything really. So, but getting someone to realize that and let them know that they're being supported by the community is super important. There are a handful of ways that you can become an advocate in your community. There are several different ways. We're going to talk about a few of those because we can help raise drug addiction awareness where we are. We can participate in days like today, where we're doing this Zoom. You can wear the shirts that were handed out that have the Arkansas Collegiate Network that is raising awareness for drug abuse and addiction and those kind of things. So we can start having those. Once you wear something with those logos on it, that could be what someone needs to be more open and to be more honest about what's happening. Sometimes people are so afraid that they can't open up and can't tell someone what's going on. So if you're wearing a shirt, it could be something that simple, but there are other ways to support and raise awareness for drug awareness days. Donate money to nonprofit charities and other nonprofits. They focus on supporting those that have gone through addiction and understanding that this is a disease and how can we help them through this. And so we can support charities. We can make sure that we know that behavioral health is essential to health. So prevention works, treatment is effective, and people recover. It's not something that we just have one part without the other. It's not something that we try to limit and say, oh, if something isn't working, then we need to change it so that it can work. So if treatment isn't being effective in this mentality, okay, in this way, then let's change it and let's go to a different way. Let's try something different. So not all strategies and techniques are going to work with the same people. And so it's important to make sure that it's being effective, that we're working through and saying, hey, let's prevent this from happening. Treatment can be effective. And then people, they really do recover. During recovery months, thousands of addiction programs and groups hold events to spread the message about treatment and recovery. And this is really, really, really important because that's getting even more people to hear about that this is okay to be open about, this is okay to talk about, this is what we need to be doing. The importance of community service. Community support. Community support is all about coming together. When it comes to addiction, it can be scary and a complex road to be on. However, coming together shows us that no one is alone. No matter how lost you may feel, there is support you can reach out to. Drug addiction awareness within the community also shows us that it's okay to talk about. In fact, it's far more than okay. Openly speaking about addiction is really important, and we encourage you to be a leader in the change that takes place. So kind of what I was saying before, it's okay to say that you're not okay. It's okay to talk about what you're doing. It's okay to wear things like the shirts that were handed out, because we're just raising awareness. We're saying, you know what, this is happening in our state, it's happening in our country, and we can just do a little bitty, be just a little bitty part of making sure that there is awareness. What to do if you need help. So reach out to someone. There are resources available. So if you or someone you know is going through this, it's really important that you know that there are people that are willing to help you and that want to help you and that want you to get through this situation. There are also counselors that specialize specifically in substance abuse. So I have a little bit of training in substance abuse, but there are counselors with a lot of training in substance abuse. Like that's what they specialize in. So it's important to know that there are people that can help you get through this and that will know a million different techniques and a million different ways to kind of just grow from this experience and make sure that you can overcome addiction. If you have any questions or anything, you can always email me at counselor@asutr.edu, and I can attempt to answer any questions that you have. In the last Zoom, one question that was asked was, is there hope for someone that is going through addiction? Yes, there is hope. There definitely is hope. A person going through addiction has to make that decision to want to move forward. They have to want to be sober. They have to want to not depend on this drug anymore. So that usually takes a little bit of time, and it can be a little bit disheartening, but there definitely is hope. It's definitely still possible. Unfortunately, the statistic is pretty high on relapses. Studies are now showing that the average person relapses 7 times. 7 times. That's a lot of times. And so being aware that that person may be trying and they're still going to relapse. They may be trying and it's still going to, a relapse is still going to happen, unfortunately. Statistically, they're probably going to relapse. And so all we can do is be there to support someone. We can be there to help someone. A question, I always like to just look up questions, because sometimes people don't want to ask questions, especially about topics like drugs. So we'll start with, why do some people become addicted while others don't? This is a hard question. We don't fully understand why this is so. We do know that genes play a huge role. So the family that you're in, the genes that you carry, because of an inclination to addiction, can run in families. But strains of mice, rats, and other animals differ in how they readily develop addiction-like behaviors after they're exposed to drugs. So even if there are family members in mice community, they're still not showing the same consistent development of addiction-like mentalities, addiction-like behaviors. We also know that a person's environment plays a huge role in addiction. So that plays if they're going to be in it or they're not going to be in it. And so it's important to realize that some people do and some people don't, and we don't have all the answers on why that's true. We know that genes play a role. We know that your environment can play a role, but some people are just more likely to fall into the pattern of addiction than others. Another really good question is, does marijuana use lead to another use of drugs? So marijuana has this gateway-like drug concept that we're using one drug, where using one drug leads to another drug or other drugs. This generates a lot of controversy. Researchers haven't found a definite answer yet, realistically. But as of today, research does suggest that while most people who smoke marijuana do not go on to use other drugs, most teens who do use other illegal drugs try marijuana first. And a good thing to remember here is, if teens are trying it first, that means that their brains are less developed at this point. They're less developed. So they could lead to other drugs because their brains are underdeveloped. They're getting to this point that, and then exposing it to a chemical imbalance and those kind of things. So there's a lot of controversy on this question, but it's one of those that I always like to answer, just because it's something that I feel like everyone always asks. Is it a gateway drug? Does it lead to another drug? It doesn't always, but it has the potential to. How can I help someone if they're on drugs? One of the best things that we can do is let them know that you're there for them, and tell them that you're there to support them and that you're there for them. Tell them that that you're concerned about their use of their drug use, and encourage them to seek help from a trusted adult, maybe a teacher, a coach, a parent, a counselor, anyone. Reach out for help if you know that something is going on. You can always be a positive influence. You can always be someone that they can lean on. Get them involved in non-drug activities. Maybe joining a club, playing in a band, playing a sport. But be aware not to let their influence negatively affect you as well. So there are lots of different questions that y'all might have, but that's just a few that I felt like were super important. But if you have any more questions or need any more information, don't hesitate to reach out. And it was really nice to present to y'all. Bye. Thank you.